Hi everybody, it's Kim Bergen Jackson, administrator at Oak Knoll, and I am taping on September 6th. I can't believe it's September 6th already. We are September, October, November, December, less than 3 months away from Christmas. Can you believe that? I can't believe that. End of the year is coming, whether you want it to or not. I am here to give you an update on COVID. Or any other infection control things I can think of. We currently have one resident who is isolating and recovering from COVID and one staff member who's off with COVID. They had an exposure that was not at Oak Knoll, both of them, and so I'm glad for that. Otherwise, in general, I would say across the country, if you like to follow trends, we're seeing an increase in cases. It isn't dramatic, but it is noticeable that it is up. And there are currently 9 people hospitalized at the University of Iowa with a COVID diagnosis. So that is less than when I recorded 2 weeks ago, but it's still higher than it has been. So if you are not vaccinated and you are kind of waiting for our clinic, I don't have any updates on that yet. We have reached out to our pharmacy, Maine Healthcare Pharmacy. They have agreed to provide an influenza clinic at the main campus and at the East campus, so nobody has to travel. I do not have dates yet for that. As soon as I get those dates, I'll give them to Steve if he's taping that day, or I'll let you know as soon as I can. I also do not yet know if there will be a COVID booster included with the influenza vaccine. It doesn't look very good to me right now. I mean, we've been sort of waiting for like the last 3 or 4 months for them to make a decision about which variants they're actively fighting against and the booster. So I'm also waiting for updates from public health for that. So as soon as we know anything about the COVID boosters or the influenza clinic, I will let you know. If you're planning to travel in the next month or so and you have not had the bivalent booster, which is the second booster that came out, I would recommend that you get the bivalent booster before you travel. And then that will delay getting this new booster for you for, I don't know how long, approximately 3 months, 6 months maybe. So there's that. I also asked you the last time I taped to talk to your provider about the RSV vaccine. So that's a new vaccine that's available this year. RSV is usually what is a cold to us. It's usually in children. It gets severe and children have been hospitalized with RSV. But following COVID, all the rules kind of changed. And so our immune systems were a little less ready to handle things. And so they were seeing older adults being diagnosed with RSV. So they made a vaccine. There are certain criteria that you need to meet in order to get the vaccine, and it's not as easy as the flu shot, which we've been doing for years. And so I asked you to reach out to your physician or your nurse practitioner or your PA, whoever your provider is, and ask them if they would A, recommend that you get the RSV vaccine, and then B, tell you where to go to get it. I think it will probably be available at the major pharmacies, just like the COVID booster, but I'm not 100% sure because it's not for everybody. So you just need to find out from your provider if you qualify. Tomorrow, we have guests coming in from Australia and Canada. I don't know if I've talked about this study that we're leading. Pain Check is a company that is located in Australia, and they have created an app that can be used using facial recognition software to identify pain in persons living with moderate to severe dementia. They need a US study in order to get FDA approval for their product to be able to sell it in this country. And they reached out to the University of Iowa, and the University of Iowa said, no, thanks, we're too busy. Reached out to me, and I said, oh, that sounds fascinating, let's do it. So Oak Knoll is coordinating the United States study, and there will be 100 participants. Some will be Oak Knoll residents, some will be other Leading Age Iowa members in Dubuque and Cedar Rapids and Cedar Falls, maybe. I reached out to Leading Age members who wanted to participate. We're also working with Leading Age Illinois and Leading Age Missouri and looking for a diverse sample of participants living with moderate to severe dementia. So I am cautiously optimistic. This product has already been tested over 3 million times in Australia, New Zealand and the UK, and it is testing that it is valid. So I'm excited because we could be managing pain better for so many people who are unable to report pain because of dementia, but also down the road, people who are nonverbal, who are unable to report pain, and even babies and autistic children maybe. So, I mean, if the app works with this facial recognition software, what we can do for pain management is limitless. So of course I said yes. So our nurses will participate with me on the study, and we'll have some data entry folks, and we'll manage this along with everything we do at Oak Knoll, because we want to put ourselves out there as experts in aging, and I'm thrilled to participate. So if you see me touring people around tomorrow who look like they're not from here, they're from Canada and Australia, and they're traveling today, and they'll be here Thursday and Friday doing orientation for us with the app, so that we can go out to nursing homes in Iowa and close Illinois and Missouri and test the validity of their app against a already valid pain tool that's used for people with dementia. So that's a long story, but I'm super excited. I want you to know what we're doing. And when I have guests, I want you to know why they're here. So I'll be in training tomorrow. I'll be here, but I'll be learning how to use this cool app. And then hopefully I will get the app when we're done with the study, so we can use it at Oak Knoll to identify pain for our residents who are living with dementia. So stop me if you see me in the hallways. I'd love to talk about it. It's very exciting, cutting edge. Oak Knoll's on the cutting edge of dementia tools and adaptations for people to improve quality of life. So that is a cool opportunity, and thanks to Oak Knoll and the board and Steve for letting me go crazy every once in a while and do something cool. So that's it. Remember, I said we're 3 months from Christmas, so if you like winter, it's coming. Steve talked a lot about leadership development last week, and that went really well. You know, things are going good for me at Oak Knoll. I hope things are going good for you. I'm getting ready to travel in October, and I'll talk more about that later in the month. But yeah, that's all I have for today. So stay healthy, stay away from each other, wear masks if you want to. I know we've talked about if you're in situations where you're around people who may have COVID and you don't know. I just think for your own comfort level, do what makes you feel best. If you find yourself in a situation where you're at a Hawkeye game like Steve was with 70,000 people, but it was outside, so maybe he didn't wear a mask. I didn't ask him. I don't know that he didn't wear a mask, but it's fine if he didn't wear a mask. So it's really a personal choice at this time. If you do have a known exposure, though, I'd appreciate it if you would kind of isolate yourself from the rest of the community so we don't spread it around. If you have any questions, as always, you can reach out to me, and I'll be around. I'll see you in 2 weeks. See you then.